Hello, everyone. Thanks to all of you for joining us. It has always been my pleasure to be part of this webinars. I hope they have been useful to you. And since YINGCHI have been uploading them on YouTube, I think even the other people who don't attend the webinar also will be able to watch these videos and find them useful. Today, I've been asked to talk about TMS, the role of TMS for addiction and craving. So I'm not going to talk about anything about theory. We are going to talk only about what we have done and our experience. So it's going to be a very brief talk, but something that is really practical, something that we have used. And so this is our experience that we would like to share. So what are the addictions and cravings that we usually encounter in our practice? The first thing is tobacco, second thing is alcohol, and third thing is narcotics, and fourth is prescription drugs. So these are the four different chemicals that people are addicted, and they develop craving, and to which they come to us. So this addiction, what we have realized is in our practice, either they come with alone, so they come with that they're addicted to nicotine and they want some help to get them de-addicted, or alcohol, or these are patients who come with a stroke and other neurological disorders, and we find that they have addiction and cravings. So either these patients come alone or with the addiction and craving. So what have we used for these patients? As usually, we use the left DLPFC. We have found it to be the most useful of all. We believe that it is a workhorse for TMS therapy. Whenever you don't understand anything, use left DLPFC. We have never been disappointed. Let me put it that way. So I think if you don't know what to do, use left DLPFC, and you won't be disappointed too. And left DLPFC, even if it is not the main area, it is a junction of several underlying neural networks. And by stimulating or inhibiting left DLPFC, you will be able to control a lot of other networks. And we use 2000 pulses and frequency of 10 and 2 sessions per day, and at least we use 30 sessions. And if they have other neurological disorders, then we stimulate other parts of the brain. So if they come with stroke, then we stimulate the motor strips, the abnormal motor strips, and then inhibit the normal motor strip. And if it is anxiety, then we include even the DLPFC. Results are very gratifying. We have done maybe about 30 cases of primary addiction, mainly to tobacco and alcohol, and to several other patients who come to us with stroke and other neurological disorders. And we find that they also have addictions. So we treat both the conditions, and the results are gratifying in both. This is one case. She had stroke, and she had hand and leg hemiparesis also. So this way, so this she not only she's a lady, she's talking in English, in Telugu, one of our local languages, but essentially she had developed a stroke because of nicotine, and now she's telling that she has improved her hand and leg movements, and also her craving for tobacco is also gone. This is the same woman who is again demonstrating that she's able to walk even slowly after her recovery from stroke and de-addiction therapy. See, she's able to walk fast also. And this is another gentleman. Again, he developed a stroke, and now he's able to move hands and legs normally. He's very happy with the results. And even speech is also. So to conclude, these are I've shown some videos of some patients who had stroke and other addictions, and they got improvement in their primary neurological problem as well as got de-addicted. So I think TMS therapy is a very useful tool in de-addiction therapies. It has to be integrated with other therapies. With drug addiction being an increasingly common problem, role of TMS is bound to increase. So we better be all be prepared to understand how we can use this TMS therapy for these patients. And I thanks once again to all the staff at YINGCHI for setting up this platform for exchange of our ideas, and also to all the participants who have joined us. I'll be happy to answer any questions in this regard.